I find a caregiver, a babysitter, a nanny, a grandparent who'd be willing to watch my COVID-19 exposed child? In many ways, these unpredictable 2-week quarantines for individual children or classrooms because of exposure to COVID-19 at school can sometimes cause more chaos for families than what we saw with the blanket school closures back in the spring, where all of us who are working parents were mostly in the same boat as we tried to juggle our personal and professional obligations. What people can do now, including families, schools, and importantly, employers, is to prepare for these inevitable disruptions that we know are coming from COVID-19 exposures at schools. Preparation now will help ensure that families will be able to follow these quarantine guidelines so that we slow the spread of the virus, and that schools can remain open for in-person learning that is so important for children and families.
Excellent, thank you very much. Lots to dig into there. For a moment, Dr. Akinboye, I would like to move on to you. What do you see as the most important questions for school administrators to address as they put together reopening plans, and which of those questions have answers so far?
Thanks, Greg. I think prior to addressing all of that, it's important to just lay out the context by which I think I will approach these questions today. As a community, we should have the shared goal of acting in the best interest of children. And I think right now that will take a lot of time, money, and certainly decrease COVID-19 prevalence. So in the context of all that, what are the 3 questions that school administrators should at the very least keep in mind as they start to plan reopening? I think the first one is, where will kids learn? And we may have answers to that. We do need to have probably more specific answers to that. And what I mean by that is, will it be at home or in school? And if it's at home, what virtual concept is free, accessible, and equitable across all learning platforms for kids to use? I think the second question is, who critically needs to be in person and who can remain virtual? And what I mean by that is, this does not just impact students. It certainly affects staff, teachers, and all of those people that may be peripherally related to schools, who would need to be on campus or in a school setting, and who can remain remote. I don't think we have answers to those yet. I think that's going to be evolving, and it may change depending on what the plan that's picked or what plan is rolled out and what community prevalence looks like as we go forward. I think the third and very important question alludes a little bit to what Dr. Wong mentioned, which is, where can schools get help when and if they have to manage an infection cluster? For now, we have some early answers, the most obvious being the local health department, certainly local pediatric infectious disease doctors, or just clinicians, so pediatricians, public health officials, nurses, and we have multiple layers of help, but we may need to reach further into our community settings, have people donate PPE, have people volunteer in different capacities to ensure that if schools open and when they open, we can create a setup that it can manage infections and decrease further transmission in local communities.
Absolutely, thank you. Once again, lots to dig into there. Professor Giannetti, and I'd like to go to you for a moment. The rate of child poverty in the US is higher than for the rest of the population, and it's higher than in otherwise similar countries. How and why is the pandemic about to make that problem of childhood poverty even worse?
Thank you. I really appreciate this question, and it's really a wonderful follow-up to Dr. Wong and Dr. Akinboye's opening comments. So prior to the pandemic, poverty was already really high in the US relative to peer nations, affecting 1 in 5 children. That number is expected to soar. Our best estimates suggest it only going up to almost up to 5 million children. And part of that is, it's for 2 reasons. One is that children who were previously not poor are going to become poor. And the children who are poor are going to be experiencing even further deprivation from poverty. Children of color will be particularly hit hard. I think this is a really important question and issue locally. In cities like Durham, where we have a vastly ethnically diverse community and really different types of resources available to different individuals. So why might this be happening or escalating during a time of a pandemic? There are a number of reasons that many of us know, and I'm going to pivot a little bit back to what's happening in the home environment, which I think intersects very closely to this question about school closings and what will happen in the school environment. Parents are losing jobs, food is hard to come by, evictions are expected to increase as rental forgiveness laws are meeting their deadlines this month. The US labor market is not designed well to absorb formal care, whether it's child care for early children or even monitoring and supervision of older children. And this intersects super closely with the question of school closings. And the US lacks a strong safety net system for reaching vulnerable people. And again, schools have played an important role in filling that gap. And I look forward to talking more about each of those topics.
Excellent. Thank you, all three of our panelists, for those openings. We have a lot to dig into and a lot to get through. So we're going to jump right into questions. I would remind those of you joining us on Zoom that if you'd like to ask a question, you can type it into the Q&A window, or if you'd like it to ask in person, you can press to raise your hand on Zoom. And if you're joining us via cell phone and would like to ask a question, if you hit *9, that will raise your hand in the Zoom call and we can unmute you and you can ask a question that way. So one question that we have that's come through via email, Dr. Akinboye, I'll come to you first on this. And the question says that, is it possible the virus could mutate in subsequent waves to start to affect children at a higher illness and transmission rates? Is there any precedent, that other coronaviruses have done that? And if it's the case, then obviously could the impact on children and schools be even worse?
So I address the question in two parts. I think the first part is, have other viruses mutated and affected or infected different populations that will be different from what we have seen in the past? And I think the short answer is yes. We don't know enough about SARS-CoV-2 to explain exactly what a future mutation would look like. And we're still trying to understand the pathophysiology or the mechanics to explain why it does seemingly, it seems that children have milder presentations of an infection and seem to also not transmit this as effectively as adults do. So without having those key important items, I think it may be hard to explain what a future mutation would mean, but it's possible. I don't think in the last 6 months we've seen that happen, and some people have already started to describe mutations, and so I would not expect that in the short term this would impact the transmission within schools. I think the second part, and to make sure I address that completely, please correct me if I'm misinterpreting the question, but I think the second part was how this would impact just kind of school reopenings in terms of transmission. And again, at the risk of repeating myself here, I think it's going to be hard to know, but we do have epidemiology data from the last few months that suggests what happens in the United States, and that's what we should use to inform the next steps.
Gotcha. Thank you very much. We also have a raised hand among the attendees. So if we can go ahead and unmute and go ahead, please ask your question.
Hello, this is Laura Leslie from WRAL. Thank you for taking my question. A couple of questions, actually. First, and I guess this is for Dr. Akinboye or for for any of the panelists, but do we see a significant difference in risk between elementary age students and teenage students in high school? And secondly, there's been some talk about allowing this to be a county level decision. What if we, does that sound like a good idea to you, or would that be fundamentally inequitable? How would you respond to that? Thank you.
Thank you for that question. The question is regarding, so the most recent one was, how do we address this in terms of just levels of making plans and transmission? And then are we seeing a difference in transmission between younger kids, I'm going to say elementary kids, and older kids, probably high school kids? For the initial question that you mentioned, yes, we are seeing a difference in the way in which the infection presents itself. It seems to be milder in younger kids. And knowing that younger kids have not been in larger congregate settings, particularly schools, we've not seen a lot of transmission in that age group. But I will say, particularly in our area, we've had child care settings that have been open all through the pandemic, and they have kids from about infancy all the way to about 3 to 5 years of age. And until recently, we have not seen rapid clusters or rapid spread in child care settings. As our community prevalence has gone up, we have started to see some clusters, so some infections among staffers and among children, and that's not unexpected when community prevalence goes up. And your second question, I think we have to decide how we define local, but I'm in full support of making decisions based on local data. That may be at the state level, it may be at the county level, but if we are going to do that, we have to ensure that resources are available across the board. And so counties that historically may not have had adequate access to resources can get them, even if they have to make decisions based on their county data.
Yeah, and this is Dr. Wong. Oh,
I'll
add to.
I'll go next. Go ahead.
Okay, this is Dr. Wong. I'll add to what Dr. Akinboyo just mentioned. I think when thinking about the risk for example, elementary versus high school students, we need to think both about the risk of infection, but also the potential benefits and what's developmentally appropriate for an elementary school student versus a high school student. Developmentally, we think that maybe middle schoolers and high schoolers will be able to wear masks. That is probably not going to be developmentally appropriate or feasible for our younger children. And so some of the, what we call mitigation strategies or strategies to reduce the spread of the virus in schools are going to look different in elementary versus middle and high schools. Also thinking about the importance of education and the COVID slide that we've already seen from the last missed semester. High schoolers are going to be more able to remote learn than elementary school students. Is it an ideal way for them to learn? Probably not for most high school students, but they are at least better equipped developmentally to do that than a kindergartner, for example. So when thinking about which schools to reopen, elementary, middle, high school students for in-person learning, it's important to think about all the different risks and benefits to children at different developmental stages. In regards to the second question for should this decision be made locally, I do agree with Dr. Akinboyo that I am also in favor of these decisions being made more locally, both because we know that the rate of community spread is very different in different localities across North Carolina, across the country, and also because we, as Dr. Akinboyo said, we are still not sure what the best way to open the different schools are, elementary, middle, high school. Is it 1 week on, 2 weeks off, 2 days in person, you know, with cohorts? This is going to be an opportunity for us to learn and to course correct as we go, because we're probably not going to get it all right out of the gate, because it's the first time we've ever tried to do something like this at this scale across the country. And so it'll be really important for us to monitor what's happening and then to improve how we're doing to make sure that we're protecting the health and well-being of children, families, and importantly, the staff and teachers at the schools.
So this is Dr. Giannetti, and I want to echo and support all the comments that are made so far with my peer colleagues at Duke. You know, developmentally, the other thing to think, I think it's super important to think about developmental stages. We know this from examining poverty and its impacts and how it's greater at early stages of childhood versus later, and how it's important to continue addressing poverty, for example, as children age. And it's certainly true that as adolescents might be more likely to behave and be able to follow these rules, they're also more independent. And so I think the more that we can think about respecting their social development as well as their learning, the more likely we will have success in thinking about school openings and supporting their development. With the second point, I think it's important to recognize this distinction between having some authority at the local level, understanding and appreciating what's happening locally with local data and local context, but also the value of having state and federal guidance and collaboration and coordination. I think it would be an error if every county, if every city acted on its own. One of the beautiful aspects of the United States is this concept of trade and mobility across communities, across counties, across states. And I think we've seen some success in the Northeast because of some collaboration that's happening, not only between, let's say, New York City and New York State, but also across the states. And that really made some headway against the pandemic. So I think some decision-making and guidance from above in collaboration with what's happening locally is probably ways to point in the right direction this pandemic.
Excellent. Thank you, all three of you. Laura, I hope that answered your question. We have another raised hand, Brian Dunlevy. So if we can go ahead and unmute Brian, and you should be able to go ahead and ask your question.
Thank you so much for taking my question. I appreciate it. I'm just wondering sort of what the status of the data is on how children transmit COVID-19, how effective they are at transmitting COVID-19. And given the fact that we seem to learn something new about this virus almost daily, is it really maybe premature to even talk about widespread opening of schools, given the fact that we could find out something more about transmission among children on down the line? Thank you.
So this is Dr. Akimboye. I'll take an initial stab, and of course, I look to the rest of the panel to address this as they deem fit. I think for the initial question, we have some specific data, both internationally and then also locally. And I'll try and be a little bit more specific in my response here. So one recent study came out of Chicago and was just looking at the early days of the pandemic, tracking infection rates and how household transmission was occurring. And you can question some nuances of statistics and how we analyze data, but essentially they found out that when they look at households, most often the adult in the household was the one that was initially infected. And if it was the child that was infected, there seemed to have been less than a 15% risk or a chance that the child would then transmit across the household. And we don't know why. But then the caveat to that is when a child is exposed to an infected adult, seemingly we're also picking up lower rates of them getting infected. You could argue about our testing strategies. If they don't have symptoms, can we actually find the virus? And all of that we're going to learn about as we move forward. I think this is a pandemic, it's unprecedented times, and we're forced to use data as we get it. We've had about a 6-month leeway and we're learning every day and we're going to continue to learn. So I don't think it's premature to have the conversations, but I certainly don't think we can rush into any decisions because a lot of data are still preliminary and they have been obtained in the context of most of our nation's school-age children being in a household setting and outside of congregate settings. So we should certainly start having the conversations. We should be cautious as we approach final decisions and be very flexible to adjusting if and when we get new data.
Yeah, and this is Dr. Wong. I'll add to that. I think also, again, when thinking about the different age groups of children and what we're seeing, as we've mentioned before, both it seems that the virus behaves a little bit differently in younger children, for example, even those in daycare compared to those who are in high school, but also what families are able to do in regards to separating a high school student more from their family compared to a younger child who is still very dependent on their family members to do things like feed them and bathe them. So again, thinking about the developmental stages of children and how there is a lot of difference thinking about our younger children versus our older children. I will say that we just want to make sure we again highlight there's a really strong case for trying to reopen schools because there are so many benefits, both for children, not only their academic benefits, but also their health and well-being and social emotional health, particularly benefits for children, and also for families, many of whom are really trying to get back to work to restart the economy. However, I agree with Dr. Akinboye. I think we really need to proceed with caution and care and avoid broad sweeping mandates about requiring schools to open because we are certainly very early in learning about the experience of children and their experiences, particularly in schools and other congregate settings in the United States. While you're correct in that we've seen an explosion of COVID-19 research and we're learning something new every day, a relatively small proportion of that research has been on children. I am happy to see that because of the questions of school reopening, we are going to see more of that research emerge that is focused on children because the well-being of children is going to be a really critical component of us being able to manage and overcome this pandemic together.
So I wanted to add more to the considerations here since we've started this kind of notion of trade-off thinking, which I think is ultimately what each of us is speaking to on the public health side, as well as economic support for these children and families. And so as we think about school openings and closings, we should really think also hard about the function of schools more broadly in these communities. They're not just environments for learning. Of course, they're their primary objective. But they also offer a number of things. We've already mentioned a little bit of the childcare function that they serve for families, lacking any other kind of market to support childcare and care of older children. They also serve as accessible places for distribution of services. In some cases, actually recently that's been food, and kind of stepping up as the most cohesive system in our country right now to distribute food, in addition to food banks and other and faith-based communities. Access to psychological support, even access to families to think about work and other services. Teachers and professional staff as part of schools are important gatekeepers to detect neglect and to help support children with services outside of the school environment. Schools also offer some stability in the context of disruption. Going back to the what likely is going to be happening without more support, evictions, further unemployment, and food insecurity. So I think part of the trade-offs of the public health concerns should also be balanced with what's happening with the economic environment for children in all these local communities, and not to forget that schools serve multiple functions.
Excellent. Thank you all three for that. I'll remind everybody you can submit questions via the Q&A window. Several of you have done so, and that's great. You can keep them coming, and you can raise your hand. And for the hands that are getting raised, we will get to you. But I'm going to move on to a couple of questions we had come through via the Q&A window. And one of them asks from Carolina Journal, have there been any examples of COVID-19 outbreaks or clusters in schools anywhere in the world that you're aware of? And is there anything we can learn from those?
Again, I guess I could start off. This is Dr. Akinboye, and the question was regarding school-based clusters around the world. And as most people would know, yes, there have been a number of examples. I think one of the ones that have been reported fairly consistently on occurred in Israel. And there have been a few within European countries as well. But I will say there have also been a number of countries, particularly in Europe, that have opened schools safely and have done so in the context of low community prevalence of COVID-19. We can learn a lot, and one of the main things we can learn is the only way to reopen schools safely would be to have a comprehensive approach to reducing COVID-19 transmission in our community. And that requires everyone. Every single person that exists in the community has to play a part in reducing transmission, so that when schools open, at the very least, we do not create a community bleed where transmission within the community is also happening within the schools. I think that's probably the key step. And then also looking at how countries have developmentally tried to create strategies to reduce infections in kids. So for some people, they focus on masking for older kids and focus on creating bubbles or cohort effect for younger kids and ensuring that they can still see a smile and they can still make eye contact and things like that. Kids learn differently, and ensuring that what strategies we implement are not going to do a disservice to our kids as they learn.
Yeah, and this is Dr. Wong. I'll add, I agree with everything that Dr. Akinboye said. Another consideration, and we're not there yet, though other countries have been piloting and testing different strategies for using testing upon entering schools. Right now we mostly are using the test where a Q-tip gets stuck up a child's nose, which is certainly uncomfortable. I am really, again, excited to see the innovation and the progress that's been made in developing more of the oral swab tests, because once we have tests like that available, even tests that are able to be done at home, that really opens the doors to a new strategy for safely opening and having children return to school. If we're able to do more regular testing, we call that surveillance testing of children, staff, teachers who are attending school. Again, we're not there yet, but we should be looking to other countries that have started doing some of those strategies. For example, in Germany, in their high schools, they had students testing themselves upon entry at a regular interval. And those types of strategies should also help to slow the spread of COVID-19 in schools.
So I will respond very briefly to that, and I will continue to encourage different opinions on this, but I will slightly differ from that because I've struggled with seeing testing as the entry criteria or re-entry criteria, particularly because of the testing efficacy in kids. And so if we have children with milder symptoms who may still be able to transmit but test negative, and we use that as our decision-making process, we may do ourselves a disservice. However, there is no perfect answer, and there is not going to be a one test fits all. And so I would encourage more discussion around the use of testing. But I do fully support Dr. Wong's comment that we all need to ensure there's access to testing, particularly for kids as they return to school if they need them.
So I will, this is Dr. Janetti, and I want to contribute to the good points raised so far. And for me, it's very tricky thinking about what we can learn from other nations for a couple of reasons. One, we don't have a safety net in the way that other nations do. So it's just simply better everywhere else except for the United States. It's not that we don't have it, we just have a very different one, much more fragmented, a bit more inequitable, designed to minimize fraud, not designed to protect children. And so that is one sort of context difference that may affect how the school reopenings can play out. The second is we just have a much more heterogeneity and diversity in our population. And as we've witnessed in the last few months, you know, a lot of distress over that heterogeneity and how economic resources have been historically allocated. And that kind of strife is not as present in many of our peer nations. And so we have to consider that also during the school reopenings and how we're going to make these comparisons. And then the third is we don't have a history of, again, I'm going to go back to my, you know, this is a question for myself and for others is how we think about the role of leadership and leadership going beyond local communities and establishing social norms that are public health favorable. So this goes all the way through to social distancing and wearing masks and how that can then have ripple effects throughout communities and allow us to at least prevent, you know, spread even before it starts. That is a much more challenging thing, I think, in the US, I suspect, than our peer nations.
Gotcha, thank you.
Just add, oh, can
No,
I add
please
one
go
more
ahead.
thing, Greg? Yeah,
Yes.
and Dr. Ackenboy, I completely agree with you. I think there's certainly so much still to be learned about testing and particularly how the different types of tests perform in children compared to adults. So again, I think Dr. Denison, to your point, I think this also again calls for leadership and coordination so that as we're doing the really important research to fill these critical knowledge gaps, we make sure to include children in these research response agendas so that we can learn more and determine whether or not testing upon entry to schools is going to be useful in children because of the testing characteristics that we have.
Yeah.
Thank you all so much for the comprehensive answer there. We have another couple of hands raised. So if we can go ahead and unmute Beth Mole, who has been patiently waiting to ask a question. Beth, please go ahead and tell us who you're with and what's your question.
Hi, thank you so much for taking my question and holding this session. I'm with Ars Technica, a science publication. I wanted to ask a question, I think for all three of you, if you could talk a little bit about sort of long-term effects. Obviously, last semester, the spring was disrupted with quarantines and hybrid models and you know, maybe people taking, or school systems using, you know, maybe a few days a week kind of schedules. Things are maybe going to be disrupted for a long time. So could you talk about, you know, can kids catch up, you know, in different age groups and different income groups? What should we be, you know, how is this going to affect them for the future?
I'm happy to kick off and answer. This is Dr. Janetti, and thank you for asking that question, long-term effects. We're so focused on what to do now. I think it's hard to have a vision of what the future will look like. Back to the theme of economic resources being constrained. And let me add to that we have something else going on now, which is uncertainty and adding a lot of stress to families. So the combination of economic uncertainty along with overall distress does not fare very well for children. It'll especially affect children during their early years of development and their brain development, and my colleagues can speak to that a little bit more. It will affect older children too in a particularly interesting way. You know, we have children graduating from high school with a real milestone ahead of them going to college. We have children, young adults graduating from college with a real milestone of entering the workforce. And what we've learned from prior economic recessions is that it's very, very, very hard for them to catch up. Because what happens is the pandemic will subside, and I hope my colleagues will agree with that. Maybe we can end with a note of optimism. This will pass. The economy will rebound. And at those points, children will also rebound. But there are going to be generations of children who will have some negative effects, potentially for a very long time. It's going to be very hard to recoup earnings, for example, for the current generations of children who are ready to enter the workforce.
Yeah, this is Dr. Wong. I can add to that because I completely agree. I have been asked by reporters, will this pandemic be an adverse childhood experience for children? And I think for many children, particularly our most vulnerable children, this will be an adverse childhood experience. I'm an adolescent medicine pediatrician, so I mostly work with teens, and particularly teens who have mental health conditions and issues. We have seen such a spike. This is, in our own practices, this has been borne out across the country, across the world. Children who didn't previously have a behavioral health diagnosis or condition of depression or anxiety, having new diagnoses of depression, anxiety. Those who already had these diagnoses having exacerbations. I've had patients describe them to me as being stuck in an anxiety attack and having a really hard time getting out of that, because particularly for our older youth, they are very aware of the economic stress that their parents and their families are experiencing. I think for other very vulnerable children, we are also seeing cases go up of child abuse and neglect. Again, as Dr. Janishan said, schools are a place, and physicians' offices are places that abuse and neglect are often picked up. And with school closures, and also we had a dramatic decline in families coming into our pediatric offices attending well child checks. Even as we've made those available virtually, we are seeing still a slow uptake, and some families still not feeling comfortable coming into the offices. So some of these safety net locations where we pick up abuse and neglect in our very vulnerable children are not there for these children and families. And so certainly for those children who experience abuse and neglect during the COVID-19 pandemic, this will be an adverse childhood experience, which will have lifelong consequences for children and their well-being.
My colleagues have stated this far better than I could, so I agree with both Dr. Wang and Dr. Janishan. I will say we're all worried about long-term effects, and I think the only thing I will add here is the fact that we also need to prioritize child-centered metrics, both in how we're reviewing the pandemic and how we're monitoring the effect of the pandemic. It may seem like an afterthought currently, but children are our future, and we can do better in monitoring how this is impacting them currently and in the future.
Excellent. Thank you, all three of you. We have another hand raised in the chat. So if we can go ahead and unmute, we're ready to take your question. Please let us know who you are and who you're with.
Hello, this is Adure Achumba with WFMY News 2 in Greensboro. Again, thanks to the panelists for this session. My question is this. Now, so far, based on the conversation, you have said that ensuring safety of the kids in school depends on various conditions that include these suppression strategies like testing, expanded social distancing, and masking. But we've seen a lot of jurisdictions sort of struggle in this area, and they've had challenges and difficulties with just keeping these basic or what many of you have said are the basic suppression strategies. Now, in light of that, and again, without putting any assumptions on your own personal cases, but putting yourselves in the shoes of many parents who are waiting for these decisions. Now, would you then, under these circumstances, send your own kids to school at this time?
I'm happy to volunteer as first, and then this is Dr. Janetian. So thank you for that question. And yes, this is at the risk of sort of revealing sort of how we think of ourselves as professionals, but some of us are also working parents. So I have 3 older children, 1 in high school and 2 in college. And I've been, I have to say, impressed with how hard local schools, universities, districts are working to think creatively about how to bring children to school, how to sustain their learning in a safe way. And so, there is recognition. It's not going to be anything like it was before. But I'm very grateful for the creativity being put to the table. And in my case, 2 are at universities. They will each be going back to school in a hybrid fashion, and in some cases in a fashion in which they will be deliberately sort of clustering with small groups of peers with sort of an agreement that this is going to be their social circle. And as the economist, I think that sounds pretty good, but I will let my colleagues speak to the promise of that kind of approach.
Yeah, so I have 2 children, one who's in elementary school and one who is in daycare. we in our family, like so many families, are making a very individual decision, weighing a lot of different trade-offs regarding what's the risk of infection, how important is it that our children who are younger have the social emotional development. At their ages, it is really quite inappropriate, in my opinion, to try to distance learn, for example, in kindergarten. And so we are planning to send our child who's in elementary school back to school in person if that's an available option. We are also weighing that with the needs to have childcare and coverage given the different schedules that are being released, for example, with only 2 days per week or different weeks that are going to be in-person learning. And we are working really creatively with our community in our neighborhood. We've been, all of us who are parents and working parents have been talking with each other about how we can support each other, how we might, like Dr. Janeshian said, create clusters where we have caregivers and parents who share the responsibilities on different days for caring for the children, making our own little pod, so that we're both able to parent, help support remote learning on days that that's happening, as well as fulfill our professional obligations.
I wouldn't be presumptuous to tell any parent what to do, particularly with also many uncertainties. And because I don't have to make the decision about schools currently, this is not something I can weigh in that personally, but I think I would agree with what everyone has said, which is that the pandemic is not going away anytime soon. And so really relying on our communities to see how we can support each other to create an environment where learning can occur and parents can function, which function also means having some sort of a stable income, working if you need to, or being home with the kids if you need to. It's probably all I have to say on this.
Gotcha.
One thing
Thank
that
you.
Okay, Greg, can I add one
Go
more
ahead.
thing? I think,
Please do.
I think another consideration that we're certainly hearing, because we have a lot of families who are asking us in our primary care pediatrics practice this very question: should I be sending my child to school? When we think about the different considerations that each individual family needs to think about, it's also about who else is in the household. Do you have a child who has risk factors, conditions that may make them at higher risk if they were to get an infection? And then more commonly, who are the adults who are living in the household? We know that there's a much longer list of conditions that put people at higher risk. Particularly, we've got a lot of non-traditional families, particularly in some of our vulnerable lower income families where they have non-traditional households, where there are grandparents and aunties who are all living within the same household. Thinking about, again, what's the risk tolerance of each family for sending their kid to school, knowing that there is an increased risk of exposure to COVID-19 in schools. We are never going to be able to bring that down to zero, but thinking again about each individual family's situation.
This is Dr. Janae. I just want to add to that as schools and districts move forward and families consider their individual context, that to the extent that we end up in a model of hybrid learning, not to be presumptuous also about what children have access to outside of school environments. So internet access, iPads, laptops, a safe, quiet place to sit and learn. These are all, I think, should be on equal ground, right, in considering public school openings. It seems unlikely that public schools and schools are going to be open every day in their usual schedules. And I don't think I've heard a lot about what's going to be done resource-wise to support children's learning outside of the school environment along those lines.
Splendid. Thank you, all three of our panelists, for that very comprehensive answer. So one question that we've had is, under current North Carolina laws, all students would be required to attend the first 5 days of instruction in person. And yeah, we're seeing a lot of this across the country, as there are some pushes for complete in-person instruction, whereas schools are obviously trying to prepare for reduced numbers of children in school at any one time. Laws like the one in North Carolina, if it were to follow through, how much of a difference would it make for schools to have to be at capacity for the first week? Could that cause a spike in spreads in those schools?
I'll go first on that. This is Dr. Wong. Certainly that could cause a spike in spread. In addition, again, because this should be allowed to be an individual decision for each family, considering the risks that they have within their household, it's my opinion that there shouldn't be such a broad sweeping mandate to say that every child must attend in person at any point during the semester, and certainly not during the first week where everyone's going to be trying to work out the kinks of the new systems that have been put together over the summertime. So it'd be my opinion that there should never be a mandate, particularly at this point in the pandemic, that children must attend in person. There should always be a remote learning option.
This is Dr. Akimboyo addressing the question on the mandate for in-person learning. And I would completely agree with Dr. Wong. I think we're at a setting, we're in a stage where we're rethinking everything. We're rethinking how we eat, how we buy groceries, how we go to the restaurants, gyms, how we take public transit. Now more than ever, we need to rethink how we go to school and how kids go to school. So I'm not sure that mandating in-person appearance for every kid allows each administrator, each group, each parent and staff that are trying to figure out the best thing for a child to be flexible in those options. So going back to approaching this in the best interest of children, I think we need to allow for some flexibility, and we can't have legal mandates that completely knock those out of the hands of the local administrators that are working on this.
Excellent. Thank you both for that. And Dr. Wong, a follow-up question for you. You mentioned in your remarks earlier about the need for parents and employers to be able to plan for these 14-day quarantines that are going to happen. What are some things that parents can do right now to prepare for that? What are some things that employers ought to be thinking about in order to be flexible?
Yeah, I'll start with, this is Dr. Wong. I'll start with employers because I really think employers need to take the lead here. We know that there are going to be some of these unexpected disruptions for working parents. And so if employers could take the lead by doing things that, for example, our healthcare systems did when we saw the surge early on, developing backup staffing plans, cross-training employees to perform the essential functions for their businesses, so that if an employee finds out the night before that their child's classroom has been quarantined, that employee won't feel pressured to come to work the next day because there wasn't a backup staffing plan in place. Certainly these next set of recommendations require more funding, and we've seen some of the emergency funding come down, but other policies like expanded and non-punitive paid family leave, flexible work schedules, which many of us have been practicing, flexible locations that working parents are allowed to work. And then also, in some cases, subsidized emergency childcare. If schools or daycares close unexpectedly, employers can really help fill that void for employees to make sure that they have a safe place to send their children so that they can still fulfill their responsibilities. This will, of course, be incredibly important for any essential working parents, but also any other parents who are requiring their income. As far as what families can do, it's a tough situation to be in. Certainly one is talking to their employers to learn what plans are already in place, help nudge employers to get more prepared now as we enter the fall when we know that some schools will reopen and we'll see some of these exposures. And then also for families to think about what support networks do they have in their communities, neighbors, other family members who might be a bench basically for childcare when these unexpected disruptions happen. But again, I think it'll be particularly tough if it is a disruption that is related to quarantining your child, because I think it will be very difficult for families, and this is what we're seeing already in some of the children who have been exposed. You know, what childcare provider is going to agree to watch a known COVID exposed child, which would potentially put themselves and whoever they live with, if anyone, at risk? It's a really tough position for families to be in. So the more that we can prepare now, and particularly employers taking the lead so that employees feel supported when these events occur.
Excellent, thank you. And Professor Giannetti, and I'm wondering if you want to weigh in here, because obviously when children are out of school, it's having this measurable effect on increasing poverty. How concerned are you about these sudden quarantines and children who are maybe in school being taken out of them, worsening, worsening personal situations across the country?
Yeah, thank you for that. I was going to naturally chime in. So thank you, Dr. Wong, for setting up that context. So I think we should be careful. Certainly employers are part of the many actors and systems that should be interacting and coordinating with schools and public health and politics and everything else. But we should be really careful about the high burden that we might place on employers, because their reactions and the way they react, depending on what kind of employers they are, might have inequitable effects. You know, we've seen, and I'm thinking here about low-skilled laborers, which interacts very closely with child poverty. So the reality of child poverty is most of those children are living in families with an employed adult, and their earnings are just very, very low or erratic. And that's why household income is so low. Those workers are incentivized to go to work. They need earnings, they need to pay for food on the table. And as we've seen, there have been many cases that they are bearing that risk of COVID-19, lacking any other choice. And so it will be clearly in those cases, employers are not going to be in the position potentially to close the door. And also in conditions of high unemployment, from the employer's perspective, there is a labor market in which they can pull from. So I think employers certainly will have a role, but I'm going to go back to the point of government. So government also has a role here, job guarantees, extending unemployment benefits, all the wonderful things that Dr. Wong talked about that we hope and can develop as more systematic components of the labor market moving forward, including paid leave. And one of the other things that we haven't discussed so far that certainly would help with preventing soaring child poverty and help families is cash allowances. And so there was a stimulus check that was distributed in the spring in response to the pandemic. There's been some on again, off again conversation about whether there should be another check sent out to parents and families and individuals in America. And that should come back out as a real part of this conversation for economic support. So literally having cash in the hands of families so they can continue, to stimulate the economy, right, by purchasing what they need to purchase, and continue to support environments for children, irrespective if they end up, learning in a hybrid environment or in the school. And we know something about this. We know about the role of cash allowances and cash gifts, and we're learning more. So I hope that will certainly be part of the overall conversation as we're moving forward through this pandemic.
Splendid, thank you. Dr. Akinboyo, got a couple of infection control related questions for you here. One is that obviously one of the terrible things about the situation right now is that US is trying to reopen schools even as cases are getting worse. Do you know, is there any data from anywhere else in the world where schools were reopened when cases were still climbing? And is there anything that we can take from that? Is there any way to do that safely?
For better or worse, the US is quite unique in this situation. I do not know of data in which schools were reopened in the context of what we're seeing in the US, and that's because of the rate of infections in the US. You can see compared to a lot of the other countries, we're far higher than a lot of other countries. So we would be the first to reopen schools in that particular context. That being said, if we are addressing reopenings at a more local level, even at a statewide level, and you're saying lower prevalence, we can look at comparative countries that have similar prevalences and schools have reopened and reopened safely. Sort of a roundabout way of answering that question, but the US is in such a unique situation, it's hard to have objective data to address that at this time.
Sure, absolutely. Thank you. And another, we've talked obviously a lot about children. That's the focus of this briefing. But of course, the reopening of schools poses great risk to teachers, many of whom are in vulnerable populations themselves. What kind of risk does reopening pose to teachers? And then obviously there's the knock-on effect of if teachers get sick, the ability to even provide teachers to classrooms. How concerned are you about that?
Yes, and thank you for bringing that up, Greg. I don't want to undersell the importance of teachers in all of this. I know we're focusing a lot on kids, and we focus on them because we know historically kids go to school. Most parents will tell you, my child gets a virus every month, and we just deal with it. And I think that's why there's been a lot of conversation about what to do with kids coming back together and exchanging viruses, essentially. But we also know that people that have to interact with kids consistently also pick up infections here and there, and we're actually more worried about what's occurring in adults right now, because we're saying a lot of children have milder infections, but when we see it in young adults, older adults, people with comorbidities, and that list continues to increase, we're worried about long-term effects. And so going back to the original question, I think any plan we make has to consider the impact on teachers. Yet, I'm also reassured that there are a lot of protective measures that can be put in place if we can open in a community that has a decreasing or lower prevalence, that can reduce the chance that a child will transmit an infection to a teacher, or vice versa, and still provide an environment where safe teaching can occur, with some flexibility to allow for newer teaching techniques that I can come up with, but people that are skilled and versed in this area can continue to come up with.
Thank you very much. I'll give our other panelists a chance to weigh in on that if they've got anything to add.
Yeah, I'll just add, again, I think it's so important to consider the teachers and importantly, all the rest of the staff who work in the schools, the bus drivers, the folks who work in the cafeteria, the folks who are going to be helping sanitize the school with greater frequency during this time, because we do know that they are proportionally have a high proportion of those workers who are at higher risk because of their underlying medical conditions. I'll throw one other thought in here. I think this is more for daycare teachers, but there are a lot of daycare teachers that don't have health insurance, and yet we're asking them to go in, and because they're interacting with younger children, they are having close contact with these kids, even though they're trying to wear masks and gloves. But again, to appropriately provide care to these younger children, you need to touch and pick up the babies and the toddlers. And so just really pushing for thinking about how we're ensuring that we're protecting the health and safety of the staff who we're asking to interact with our children, ensuring that they have health insurance, ensuring that they have the appropriate protective equipment, ensuring that they have the time to make sure that those processes are in place and everyone across the school, the families who are bringing their kids to school, are aware of what those processes are. Those are all challenges because we are also trying to get school started in some cases early, because we know that the fall typical runny nose, fever, viral season that Dr. Akinboyo referenced, it's coming. And so the more learning that we're able to do in advance of that, where we will see, even if schools are open, children who have symptoms, many of them won't be able to go to school, or they'll be missing days here and there. And so again, really making sure that we have the support system built up around the staff, the adults who are working with our children in schools and in daycares is so important.
Greg, can I add one quick 1-minute comment here, please?
Please do, please do.
This is Dr. Akinboyo again, and I think Professor Janation may be better able to speak to some of this. But I think I also don't want to miss out on mentioning that this has disproportionately affected the Black and Latino population. And also to mention in the context of that, that a lot of our staff, teachers come from various backgrounds. And in North Carolina, there's been an ongoing fight to ensure that teachers are not underfunded and their salaries are increased. So as we're approaching this, I think the whole point of a comprehensive approach and thinking of economics has to do with addressing some of the prior issues or inequities that have already existed, because that's the only way we can go forward and ensure that we have a robust teaching force, staff, and people that help provide childcare that can continue to provide it consistently, or recruit others to help to build up this workforce.
Well said. This is Dr. Janetti, and just to build on that, we shouldn't be naive. I think one theme that's coming through this entire panel is interconnectedness. So while we give people formal titles and roles like teachers, those teachers are also parents. They're also caregivers. They also have their own children. And so it's really hard to think about a siloed one policy decision that's very focused on something like mandating attendance to schools for 5 days. It will fail. It will have negative repercussions if we also don't consider the fact that parents have to work, that children are potentially in situations where they're supporting families, or they're at risk at home in ways that means that they cannot be at school. In addition to the fact we shouldn't be naive that any one of these policies will be equitably felt by all the families. And that's largely because of an inequitable pre-existing system prior to this pandemic.
Excellent. Thank you to all three of you. We are almost to time here, so I've got one final question that I'd like all three of you to weigh in on. Here in North Carolina, the governor is supposed to make an announcement this afternoon about the reopening of schools. But more broadly across the country, what are the top things, the 1 or 2 things that you would really want governors and leaders to be putting in place for the reopening of schools? What do you want to hear from our leaders as it pertains right now to the reopening of schools in the fall?
I can jump in. I think locally we need to address the mandate. Having all children in school for the first 5 days doesn't seem consistent with the approach to reduce transmission within schools. Allow for flexibility and find child-centered metrics that protect children, teachers, staff, and anyone that's peripherally associated with the school.
Okay, I will add to that, having a companion strategy that will support equitable hybrid learning, right? And so that's having an infrastructure outside of school that's equitable, internet access, safe place to learn, quiet place to learn, technology.
Yeah, and this is Dr. Wong. I'll add that all policymakers have a developmental lens when they're thinking about the benefits, risks, and needs of children in different age groups. And with that in mind, I would really hope that all policymakers prioritize in-person learning, particularly for our youngest children and our most vulnerable children who don't have a safe place during the day or who don't have adequate nutrition during the day, to make sure that we match the limited resources of in-person learning to those who are at most need.
Excellent. Thank you, all three of you, for those points. We will leave it there. I appreciate our panelists trying to get their arms around a very timely and tough topic. Thanks to all reporters for joining us. Thank you to our panelists, Ivuka Nakamboyo, Charlene Wong, and Lisa Janetian for sharing your perspectives. Our next briefing will be at 10 a.m. next Thursday, July 22nd, when we will be discussing how to get people to follow public health advice about distancing and wearing masks. If you'd like to be included on the advisory, please email dukenews@duke.edu. If you have any questions we weren't able to get to today, please send an email to the email address on the advisory you got, and we will try and get answers for those for you today. And in the meantime, please stay well. Thank you very much for joining us. Have a great day.
Thank you.
Thank you.
Thank you, Carol.